أهلا بكم في تلفزيون CardioAlex. Okay. And with us now, Dr. Amr Kamal, Professor of Cardiology, Alex University. Hello. Hi, how are you,
Good
Doctor?
morning. Hi.
What do you think about CardioAlex2017, and is it meeting your expectations?
Yeah. Of course, CardioAlex is a carnival. It's not an ordinary meeting. It is an extraordinary meeting. We usually celebrate every year here in Bibliotheca Alexandria by this conference. It's a great gathering of all cardiologists around the world. They discuss the recent innovations in cardiology, the recent treatments. We have a good debates in hot topics, and we have also an honored invitations for most of the cardiologists from all over the world, and this of course enriches the discussion of the new items and new updates of cardiac medicine in Egypt and all over the world.
Okay, what are you going to present this year?
This year I have many things to represent. I have a chairperson program chairing sessions in intervention, in electrophysiology, and in hypertension and heart failure. And I will present a new presentation this year about the role of genetics in heart failure. And the genetics is usually the hidden part of the cardiology or every science, because nobody is interested in genetics. They are more interested in practice. I will present a lecture in genetics in heart failure. I will present another lecture about the recent trials of treatment of atrial fibrillation, and I will present a live case transmission about intervention in a multivessel disease in a coronary patient.
Okay, and what is your opinion regarding the new bioabsorbable stents?
Yeah, bioabsorbable stents or scaffolds are a new innovation in the field of cardiac intervention. But unfortunately, recently the data of bioresorbable scaffolds are still pending. I mean that there is no solid evidence of using it in regular use, such as the other stents like drug-eluting stents. So we are waiting for new evidence that will support the use of bioabsorbable scaffolds, because you know that we are living now the era of evidence-based medicine. So we have to practice upon an evidence that is support the use of anything. Still, the evidence is not certain 100% as regard the bioresorbable scaffolds, and we are waiting for the new trials to show us the importance of this type of technique in our patients.
Okay, and when to evaluate intermediate lesions using IVUS or FFR?
Sure, intermediate lesions are usually a challenging issue for the interventionist, because those lesions could be deferred from stenting, and the outcome could be more favorable than stenting or making PCI to these patients. So new techniques, especially imaging techniques, evolved in order to evaluate those patients and those types of lesions, and the IVUS, OCT, and the FFR, mainly the FFR, which measures the flow reserve across the lesion, and if it is important to stent it or not. And this possibly will reflect on the practice, either to do it or to leave it. And most of the patients have a borderline or a limit, cutoff limit, which tell us by FFR either to do it or to leave it, and this will of course be reflected on the outcome of the patient if we do or not doing the lesion by intervention.
Okay, and what is the frequency of heart failure with preserved ejection fraction you encounter in your practice?
Unfortunately, it's rising, because it was a subtle item. It was not apparent to all physicians. It was usually missed by many young physicians. But nowadays, heart failure with preserved ejection fraction is a very common thing. It accounts nearly for at least 1/3 of the heart failure patients. So, of course, proper understanding of this issue and proper treatment of such condition will improve the outcome in patients with heart failure and improve mortality and morbidity in such patients.
Okay, thanks a lot, Doctor.
Thank you.
Nice
Thank
to
you.
meet you.
Nice.
Thank you.
Bye-bye. Thank you.
I hope that you enjoy and see you next year. Bye-bye.